This conference will now be recorded.
Hi guys, my name is LaDonna Cavanis and I am a instructor here at Ultimate Medical Academy, and today we're going to be reviewing medical terms. So learning the basics to medical terms is all about pulling those terms together. So when we look at word cards, we're talking about word roots, prefixes, suffixes, and combining vowels. As a healthcare or provider of healthcare services, we need to have a keen knowledge of these medical terms, especially when working in different specialty groups, and we'll talk a little bit more about that later. A good understanding of medical terms is essential when you're working in as a medical coder, as a medical biller, and a lot of times as an administrative individual as well. Understanding medical terms is even more important when you work for specialty groups. For example, if you are a medical coder and you work in a cardiologist's office, you need to have a very good understanding of medical terms as it relates to cardiology conditions and disease processes. And the same would apply if you were a medical coding specialist and you worked in an orthopedics office. You would need to have a really good standing of the bones as it relates to those medical terms and the different disease processes that go along with working in that particular specialty group. Again, the basic medical terms are your roots or root words, your prefixes and suffixes. So these are the three primary parts. And when you pull this all together, you're able to first of all, you're able to pull together these medical terms, and you should be able to speak them pretty fluently. All right, so another important part of knowing your basic medical terminology is have a really good understanding of the 5 types of membranes in the human body. So let's take a look at it. So let's start with the mucosas membrane. These membranes line the interior wall of the human organ, as well as the lining of tubes that open to inside and outside of the body. They're normally found in the digestive system, respiratory system, urinary system, and the reproductive system. Let's talk about the serous membrane. These membranes line cavities inside of the body, as well as internal organs such as your heart. Okay, now let's talk about synovial membrane. Right, so these membranes line the joint cavities, and are made of connective tissue. Their purpose is to lubricate the joint cavities so that bones move very freely. And let's talk about the meninges. These are composed of 3 connective tissue membranes, which serve as a protective covering. They are found in the lining of the spine, the spinal cord, and the brain. And what about the cutaneous membrane? This is the largest membrane in the human body. In other words, it's pretty much like the skin. It covers the entire body. Okay? So it's important to keep in mind that medical terms are an important part of being a successful medical transcriptionist, medical coder, medical biller. Let's face it, learning medical terminology is a lot like learning a foreign language. It may be more difficult reading a doctor's handwriting or trying to decipher shorthand. However, it's business. We need to have that keen understanding when it comes to medical terms and medical terminology. All right, so let's break it all down. Medical terminology is essentially the study of the rules of medical word building. Okay, so that is the basics or the basis for creating medical terms. Okay, and the basic groundwork for building those terms, again, is by pulling those word roots, prefixes, and suffixes together to create those medical terms. On this slide, I've actually provided some examples of some prefixes. So when we take a look at the first prefix, a or an, it means lack of, without, or not. Okay, and here's an example of this prefix being used. So let's talk about analgesic. It means without pain. Let's go down to the second prefix, dys or dis. It means bad or painful or difficult. An example or usage of dis would be dysrhythmia, okay, or abnormal psychological rhythm. Here's another example, hyper. Hyper means above, excessive, or beyond. And here's an example of the use of hypertension, which equals high blood pressure, right? If we wanted to, okay, it's going to give us the example. So let's take a look at hyper and hypo. Hyper, again, guys, is high, above, excessive. That example, again, is hypertension. Hypo, or HYP, below, beneath, or deficient, equals hypoglycemia, which is low blood sugar. So hypo is the opposite of hyper. Here's another example. Let's take a look at the prefix macro. So the meaning is large, and an example would be macrocephaly, okay, which is a large head. All right, and then there's two more examples of prefixes here. I'll let you guys go over that later. So let's move on to the next slide. So now we're going to take a look at suffixes. So I've provided a couple examples for you. ACICAL, OUS, and TIC, relating to or pertaining to. So an example of that would be celiac, which is relating to the abdomen. Let's go to the next one, ENT or ER or IST, person, agent. Example of usage would be dentist. ISM, condition of theory, okay? And here's an example of that, okay? Malformation, dysmorphism. Let's go to the next one, ectomy, excision or removal. Sometimes these terms can be tongue-tying, but you just break it all down. So when we talk about ectomy, a good example would be a tonsillectomy, right? And that is essentially ectomy. The meaning is essentially to excise or excision or removal. What about plasty? Surgical repair, rhinoplasty would be an example of that, right? This is a really common one. ITIS, or itis, which is inflammation. Example of that would be a pancreatitis, okay? Ologist, one who studies or specializes in something. So that would be like a cardiologist or a neurologist and so on and so forth. Okay, and the last term we have here, or suffix, is omia, O-M-A, which means tumor. An example of usage would be melanoma. All right. All right, and here's a list of some combining forms or word roots, if you may. So when we talk about the combining form, dermot would be actually your word root, and O would be your combining vowel. But when you pull it all together, it creates this combining form, dermato, which means skin, gastro, stomach, nasio, nose, opto, eye, pneumo, air or lung, myo, which equals muscle, cardio, which equals heart, arthro, which equals joint, or osteo, which equals bone, or nephro, which equals kidneys, right? Okay. Here's a list of some commonly used abbreviations, and it's important to know the different abbreviations, especially based on different specialty groups. Okay, so let's use the EKG for example. So if you work in a cardiology office, you should become very familiar with the abbreviation EKG, which equals electrocardiogram. It is crucial that you have a strong working knowledge of medical terminology. The language of medicine is primarily derived from Greek and Latin origin. Medical terminology is used in an international language. It's also necessary for communicating with other medical staff. The wider the vocabulary base, the more competent you seem to the rest of the medical community. And even when you're holding conversations with the patient, understanding medical terminology involves breaking words down into their separate components of prefixes, suffixes, and word roots, and having a good understanding of these parts. Okay, to wrap up things, I just want to review prefix, suffix, word root, and abbreviation. A prefix always appears at the beginning of a word and generally describes location or intensity. Prefixes are frequently found in general language such as audio pilot or tricycle or submarine, as well as in medical and scientific terminology. By learning to recognize a few more of the commonly used medical prefixes, you can figure out the meaning of these terms that may not be immediately familiar to you. Let's take a look at the suffixes. They are placed at the end of the word to change the original meaning. In medical terminology, a suffix usually indicates a procedure, condition, disease, or part of speech. Okay, a commonly used suffix, and we talked about this earlier, is itis, which means inflammation. When this suffix is paired with the prefix arthro, meaning joint, the resulting word is arthritis, right? Good job. All right, let's talk about root words or word roots. The main part or the stem of the word is called the word root. A word root conveys the central meaning of the word and frequently indicates a body part. With a combining form, word root, and the combining vowels such as I, E, O is the more commonly used one. Once they're combined together, they can describe particular structures or conditions. Okay. Last but not least, abbreviations. Okay, a lot of times abbreviations take the place of words to shorten notes or documentation. When you're using abbreviations and part of the care of a patient or report, remember to always use standard acceptable abbreviations within whatever specialty group you're working for, right? So here's some helpful tips that have actually helped me along the way, and I would like to share some of these tips with you guys. So when you evaluate medical terms, you begin at the end of the word. You begin at the end of the word with the suffix, learning the individual parts of the medical term instead of trying to learn individual words. Okay, most every medical term has a suffix, so that's important to note. Remember that the word root gets the fundamental meaning of the word. The combining vowel doesn't have a meaning, but it is used to connect more than one word root or root word to a suffix. A prefix is in the front, a suffix is in the end, and a combining vowel is always in the middle. Again, I would like to thank you guys for attending my presentation on medical terms.